Welcome to this Action for Elders video, which is part of the National Heart Awareness Month. My name's David Lipka, and in this short video we're just going to be talking a little bit about different aspects of heart health and show you a few exercises that might be able to help. Okay, so the first thing is, often when we talk about heart health and the things that we see in the press and on television, there's a lot of emphasis on exercising the heart physically. So we find people saying to us, well, we need to walk more. Yes, it's good to maybe cycle, it's good to climb stairs, and it's good to do those things regularly. But we don't have to put ourselves under strain and stress to do that. Build slowly and develop that strength, physical strength in the heart. But there are other aspects of heart health that are as equally important. And that is about having a relaxed heart, an open heart, and being able to be calm and to be still and feel less anxious and less stressed about things. And both those are important in having good health for your heart. So we're going to focus more on those aspects in this short video. And the first exercise I'd like us to do is just a very simple opening up exercise where we're going to open our heart. And we talk about having an open heart, don't we? And we talk about being welcomed with open arms. So we're going to welcome with open arms. And as we do this, we're going to breathe and we're going to feel what happens when we make this movement. So, first movement is to sit well in your chair. Feel your feet solid on the floor. Find your feet. And then we're going to find a heart. Okay? So, heart in the chest, feet on the floor. Nice gentle breath in. Open up the palms of your hands. Open up your chest, open up at the back, and have a nice welcoming feeling, a nice open-hearted gesture. And then as we do this again, we're going to feel that warmth that we get from the open-hearted welcome. So nice deep breath in. Open your heart, ready for that hug that we're longing for, and then gently coming back in. Down. So talking about hugs, that's what we do, isn't it? We welcome people with open arms. Now we know that because we say that, being open-hearted. So the palms of your hands connect with your heart, the little fingers connect with your heart. And this is in terms of the Chinese meridians and the acupuncture lines that go from your hands into the chest and right across. So that's what we're looking to open up. And that's why we like to hold hands. That's why we put our hand on someone's back to comfort them. And we hold and we connect one heart to the other. And when we make the big hug, we connect directly with the heart and we enclose in this nice movement. So we're going to think about the palms of the hands, we're going to think about the little fingers, and we're also going to think about the thumbs, because it's the thumbs that connect to the lungs. The thumbs and the lungs, remember. So that's the lung stretch. So with heart, little finger, lung in the thumbs. So this stretch, we're going to open up again, taking a breath in. Now drop the elbows, open gently with your palms open, and then starting with your little finger, roll around and stretch into the thumb and open the palms. Lovely, so we get into all three areas. The little finger, palms of the hands, thumbs, and stretch and open the chest, coming in and relaxing down. Okay, again, so nice open posture, breath in, hands level with your heart. Open your heart, but not straining, just relax down, stretch like you're opening a pair of door lifts, lift doors even, and then link with your fingers and thumbs, and stretch into those meridians, and then come gently in level with your heart, and then relaxing gently down. Good. So, it's not so easy to directly affect the heart, but we can directly affect the function of the lungs, and we can do that because we can control breathing. Now normally we breathe automatically, we don't have to think. We run for the bus, the heart and the lungs work and then we sit on the bus and everything calms down again. But we can actually mechanically control that process of breathing. And when we control the breathing and we relax and slow the breathing, we give the heart a bit of space as well. So let's think about that. I'd like to open the palm again. Think about the palms open. One hand just below your navel, either hand, and the other hand in the middle of your chest. Now, rather than holding your arms up, drop the elbows down and relax your shoulders. Sit back in the chair if you can. And we're going to feel what happens when you breathe well. So breathing well is breathing down. So we're going to breathe into the bottom hand first. So when you breathe in through your nose, feel that breath come into your bottom hand. And that moves the lungs down, moves the diaphragm down. And the second movement is to open the chest at the top. So we expand at the top. Now that means we've expanded down and out, so we've got a big opening expansion in the chest, and then we just relax and let go. And let the breathing go softly out, the diaphragm moves back, and we breathe out. So breathing into your bottom hand, into your chest, and then relaxing down. Now, as you do this slowly, gently, smoothly, let your lungs fill and slowly let your lungs empty. And you can see the calming effect that that has. And what we've done is we've slowed everything down and we've given the chance for the body to be a little bit still. And that stillness is a very, very important quality that will help us to manage the anxiety that we might have. Not just because we have a heart problem, but because life is stressful and we get anxious and we get fearful. And particularly in these COVID times, you know, those are two emotions that are very strong for the heart. And we feel a bit guarded and we feel a bit worried and a bit concerned about things and a bit fearful of others and going out and catching the disease. So we go into our shell a little bit. And really, in the comfort of your own home, let's open and let's prepare for that hug that's going to come at some point. So let's open the heart. Good. So that's the nice feeling of having a calm heart, having an open heart. And just to finish then, we're just going to go into a nice relaxation and we're going to think about three things. We're going to think first of all about the relaxed body. So every time you breathe out, you're going to let go of the tension in your body, the holding. We're going to focus on the smoothness, the quality of the breath now, and that nice balanced feeling and the smoothness to the breath. So it's never hurried, it's never rushed, it's always easy, it's always calm, it's always relaxed. And the third aspect is the mental focus. So rather than being distracted with all those busy thoughts that are outside, have you put the car keys away safely? Is the roof leaking? What's happening with your son and daughter? Have you got the shopping? What are you having for tea? What about your mother? What about blah, 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 blah? What about all those things that chatter away at us? I'm not asking you to forget them. What I'm asking you to do, if you can, is to focus your attention and get discipline in your attention to focus on yourself, focus inside. So, palm open, overlap. Rest your hands lightly just underneath your navel. Rest the weight of your arms. Feel your feet. Sit back in the chair and relax. And we're just going to breathe into the hands and relax gently out. Now I want you to focus your attention. I want you to focus your attention first of all on the breath, on the quality of the breath. Second, I want you to think about every time you breathe out, it's an opportunity to let go. So every out breath, it's a bit like we sigh, don't we? And we to let go. So think about every out-breath as a little sigh, as a little opportunity to let go. And then the third aspect is paying attention. So I'm just going to sit quiet for a short time, just for a few seconds, and pay attention to the relaxed body on the out-breath, the smooth breathing, and the focused mind. That's good. Now we're already feeling different, aren't we? And we've just taken a bit of time out, which we talk about. We've found our feet, we've relaxed down, we've calmed down, we're breathing well, we've opened our heart. We've done all of that in a very short space of time without any stress. So, that's good. Thank you very much for tuning in, finding us. There are lots more sessions online at Action for Elders website. Details will be somewhere after this. And also, you might want to join us online, but you also might want to seek out some of our classes that are running in different community centres when restrictions permit that. So thank you very much for paying attention and for joining in, and I look forward to seeing you again, or communicating with you in this way at least. Thank you, goodbye.